the link in the description below. What's that taste? Well, it's your tongue, a muscular organ in everyone. I'm kind of rough with lots of bumps. I always work hard to get my job done. Your tongue is covered in a pink tissue called mucosa. Its main job is to protect deeper tissue when you gnaw. The rough parts of your tongue are called the lingual papillae. They are the small bumps that store taste buds so you enjoy food all day. There are 4 different types of your tongue's papillae. They're named the filiform, foliate, fungiform, and circumvallate. The frenum is the tether of the front bottom of tongues. It holds your tongue in place so your mouth can move freely while it runs. The back of your tongue is anchored by the hyoid bone. The tongue is vital for many things I will show. What's that taste? Well, it's your tongue, a muscular organ in everyone. I'm kind of rough with lots of bumps. I always work hard to get my job done. The muscles in your tongue are a few we will discuss. The stylohyoid, genio, all end in glossus. Then the genio and stylohyoideus. Learning these muscles of your tongue, yeah, it is a must. Your tongue's main job's to help you chew and swallow all your food. It also helps you speak all words to express your present mood. The common amount of taste that your tongue can recognize are the 4. I will tell you, it may come as a surprise. Sweet, sour, bitter, and salty are the 4, but sometimes you taste a 5th called umami I adore. What's that taste? Well, it's your tongue, a muscular organ in everyone. I'm kind of rough with lots of bumps. I always work hard to get my job done. When you bite into your food, the chemicals from food's released and sinks into the taste papilla, to the taste buds that run deep. Sensory cells transform chemicals into nerve signals that are sent into the brain through the nerve fibers. They do go. When the signals reach your brain, that information is passed through your cranial nerves to the brain stem really fast. Your medulla oblongata takes all those signals and sends them to the limbic and cortical systems. You should know perception and emotion are then formed from what you ate, then mixed with smells and texture, which create this thing called taste. What's that taste? Well, it's your tongue, a muscular organ in everyone. I'm kind of rough with lots of bumps. I always work hard to get my job done. Shop our new store merch and get custom birthday videos with your favorite characters. We're your teeth, your digestive system star. We hope you listen well and you learn just who we are. When you're a newborn baby, you may have natal teeth. This only occurs in 1 in 2 to 3,000 babies. A child's mouth has 2 rows of teeth on the bottom and the top, but you only see 20 before the adult teeth make the swap. You'll have 32 adult teeth by the young age of 13, but there are only 28 without your wisdom teeth, you see. Teeth are part of the skeletal system, though they are not bone. We play a key role in digestion to chew foods while we're grown. We're your teeth, your digestive system star. We hope you listen well and you learn just who we are. You only have 4 different types of teeth in your whole mouth. Here's their names from front to back and from north down to the south. Incisors are like scissors cause they cut your food in half. They're in front of your mouth, you see all 8 when you laugh. Then we see your canines, there are only 4 you know. 2 are at the top and 2 more are in the jaw down below. Premolars are get the crown. The tooth's visible top half. Enamel is the outer part of all the teeth in your mouth. It's the hardest part of your body, but if not brushed, it'll rot out. Here you see the dentin below the enamel closure. It's the hard, dense, bony tissue that protects your pulp chamber. Yeah, your pulp chamber houses the important root canal. Inside the root canal are the nerves and vessels' main locale. If all these top layers of your teeth do decay, the infection could be fatal, so please brush twice a day. Wear your teeth, your digestive system star. We hope you listen well and you learn just who we are. Wear your teeth, your digestive system star. We hope you listen well and you learn just who we are. Go to the new KLT Anatomy channel. Click the link in the description below. I'm your brain, part of the central nervous system. Your cranium's my home, and if you wanna learn, then listen. I'm the boss of all the functions in your body. I weigh about 3 pounds, but I'm the leader of the party. The cerebrum controls your thinking and your muscles. It also stores all memories. Without it, you would struggle. The left cerebrum controls the right side of the body, and the right cerebrum controls the left, though it is tiny. The cerebellum controls your posture and your balance. The coordination of your movement is also its talent. It's located in the lower back of your brain. It is rounded in structure, as I've gone on to explain. I'm your brain, part of the central nervous system. Your cranium's my home, and if you wanna learn, then listen. I'm the boss of all the functions in your body. I weigh about 3 pounds, but I'm the leader of the party. Your brain stem is at the bottom of your brain, connecting brain to spinal cord to form a neural signal train. Your brain stem maintains vital control of your heart and lungs. It controls important reflexes to make sure your body runs. Your pineal gland produces all your precious melatonin, which can help you sleep at night and makes you wake up in the morning. I'm your brain, part of the central nervous system. Your cranium's my home, and if you wanna learn, then listen. I'm the boss of all the functions in your body. I weigh about 3 pounds, but I'm the leader of the party. Shop our new store merch and get custom birthday videos with your favorite characters. I am your trachea. I'm about 4 to 5 inches long, an important part of you, so you'll learn in this song. When you touch your neck in the center gently, and you feel those bumpy ridges, now you'll know it's just me. Also called your windpipe, I'm 1 inch in diameter wide. I begin below your voice box, ending at your bronchi. And I carry oxygen from the nose and mouth to your lungs, then exhale carbon dioxide when your breathing is done. And when you inhale, I slightly widen and lengthen, then return to my normal size when your exhale does end. I even protect you from foreign bodies you can't see, with a sticky mucus layer in the lumen in me. When foreign substances are trapped, they're either excreted through phlegm or swallowed in the esophagus to your stomach within. I am your trachea. I'm about 4 to 5 inches long, an important part of you, so you'll learn in this song. Let's talk about my parts now that my functions are clear. We'll name off my anatomy as they do appear. The rings on me are tracheal cartilage, you see. There's about 20 of these rings that are separate on me. The reason they are separate sections called cilia that sway. These cilia trap the particles we discussed. The lumen walls create mucus through cells and ducts. I am your trachea. I'm about 4 to 5 inches long, an important part of you, so you'll learn in this song. I am your trachea. I'm about 4 to 5 inches long, an important part of you, so you'll learn in this song. Go to the new KLT Anatomy channel. Click the link in the description below. We are your lungs. We love to keep your body going. We provide the oxygen to fuel your cells so they keep flowing. We're your lungs, part of the respiratory system. You can find us in your chest. Keeping us healthy is your mission. It starts in your mouth and in your nasal cavity. When you take in a breath of air, it fills your trachea, you see. Your trachea is there to move the air that you breathe into the bronchus in your lungs. They look just like little trees. Small branches called bronchioles. They guide the air through me, which pulls it to these little sacs, and they're called alveoli. We are your lungs. We love to keep your body going. We provide the oxygen to fuel your cells so they keep flowing. We're your lungs, part of the respiratory system. You can find us in your chest. Keeping us healthy is your mission. The alveoli's job is to take oxygen from air and pass it through the walls of capillaries to blood cells in there. They also take carbon dioxide off of your blood cells, which travels through your respiratory system so you can feel well. The right lung has an upper, middle, and a lower lobe. The left lung only has the upper and the lower lobe, you know. We are your lungs. We love to keep your body going. We provide the oxygen to fuel your cells so they keep flowing. We're your lungs, part of the respiratory system. You can find us in your chest. Keeping us healthy is your mission. Shop our new store merch and get custom birthday videos with your favorite characters. I am your stomach, I'm full of acid, and I digest all of your food. I am your stomach, my job is massive. Now join me to learn all the things that I do. When you swallow what you eat, your esophagus works with me to bring the food you eat in a wave motion to me. It contracts and it relaxes until all your food passes. This process is called peristalsis, you see. The esophageal sphincter is where all consumed will linger. It's the doorway that will open into me. When the sphincter lets food pass, it closes tight and pretty fast, so your stomach juice and food remain in me. I am your stomach, I'm full of acid, and I digest all of your food. I am your stomach, my job is massive. Now join me to learn all the things that I do. My rugae are all these folds that smooth out when I am full, but wrinkly looking when there is no food in me. How about I lend you a hand and tell you about me? There are 27 bones in the average hand, see? Let's start with the tips of my fingers and you'll see there are 5 on my hand called the distal phalanges. They are attached to the middle phalanges. There are only 4 of them on the fingers of me. The proximal phalanges are what you're looking at. There are 5 that end your fingers. Now how about that? Feel the back of your hand. These are your metacarpal bones. I'm glad you're learning about me. Let's sing the chorus tone. How about I lend you a hand and tell you about me? There are 27 bones in the average hand, see? Let's look at the 8 bones that connect me to your arm. This group is called the carpals. We'll learn them with some charm. The trapezium bone is at the base of your thumb. It's a small bone and you'll learn it's an important one. The trapezoid bone is kind of shaped like a wedge, and the scaphoid bone sits on the wrist tight edge. The capitate bone is in the middle of your wrist, and it's the 4th bone I will talk about on this list. How about I lend you a hand and tell you about me? There are 27 bones in the average hand, see? The hamate bone is injured by golfers. Their club hits the ground and that is how the fracture occurs. Next to that is the triquetral bone. On the outside of the wrist is where it made its home. The pisiform bone is the next on the list. Then the linate bone at the end of your wrist. That concludes the hand bones. I hope you got the gist. Without these bones your hand would never bend or twist. How about I lend you a hand and tell you about me? There are 27 bones in the average hand, see? How about I lend you a hand and tell you about me? There are 27 bones in the average hand, see? Shop our new store merch and get custom birthday videos with your favorite characters. You have a spine, it's what you see. And if you wanna learn my parts, watch this video of me. I am your spinal column, I'm made of lots of bones. These bones are called your vertebrae. Collectively, your spine's their home. The first group we'll look at is the cervical curvature. It's made up of 7 vertebrae. We'll learn them, I am sure. The first vertebrae we will discuss are C1 and C2, also known as the atlas and the axis inside of you. The atlas joins the base of the skull you call your head. Its job to support head weight. Without it, you'd flop instead. The C2 axis allows your C1 and your skull to move about in most directions. Without it, life would be dull. C3 through C7 are there to support your head. Let's move on to the next group after the chorus is said. You have a spine, it's what you see. And if you wanna learn my parts, watch this video of me. The next group of your spine we will be looking at is the thoracic curvatures, 12 vertebrae intact. Each vertebrae we see begins with the letter T. The T stands for thoracic, let's take a look and see. T1 through T12 are bigger than the group in your neck, because the spine supports more weight the further down we check. At the bottom of this group begins the lumbar curvatures. 5 vertebrae start with the letter L, you'll learn I'm sure. L1 through L5 brings you down to the sacrum, the fused bone between your hips and the pelvis it becomes. Below that is your coccyx, also called the tailbone. It's a triangular shaped fused vertebrae, you know. You have a spine, it's what you see. And if you wanna learn my parts, watch this video of me. There are 23 discs in the human spine. The intervertebral discs is their name you will find. These discs help you flex the hard vertebrae bone between most of your vertebrae. They are shown They are flexible discs that look like tires on your car. The outer ring's the annulus and the nucleus center isn't far. Helping you bend and flex is the disc's main job. And running through the center spine is the spinal cord at large. It connects your brain to all your body's nerves. So take care of your spine because that's what your body deserves. You have a spine, it's what you see. And if you wanna learn my parts, watch this video of me. You have a spine, it's what you see. And if you wanna learn my parts, watch this video of me. Go to the new KLT Anatomy channel. Click the link in the description below. Come take a journey with me inside the human body. Who knows what we'll learn of our anatomy? Here's a quick look about the systems we'll see. In our voyage we will learn about biology. I'm a cell, your body's made up of me. There's more than 200 different types of cells in the human body. Atoms and molecules are what created me. Then I made all of the systems you're about to hear and see. There's the nervous system, it has an important job too. It sends signals from and to the brain for all that you do. The circulatory system is where all your blood flows. It carries oxygen and nutrients to where it should go. The respiratory system is what you use to breathe. It carries oxygen to all the cells that your body needs. Come take a journey with me inside the human body. Who knows what we'll learn of our anatomy? Here's a quick look about the systems we'll see. In our voyage we will learn about biology. Your immune system fights off a lot of disease. It detects when you're sick, then makes you feel healthy. The digestive system takes all the food that you eat, then extracts the vitamins and nutrients that you need. Your skeletal system is made up of bones, held together by connective tissue so they don't roam. The muscular system has 3 types you see. Skeletal, smooth, and cardiac make up the 3. Come take a journey with me inside the human body. Who knows what we'll learn of our anatomy? Here's a quick look about the systems we'll see. In our voyage we will learn about biology. Shop our new store merch and get custom birthday videos with your favorite characters. I am your spleen. You will learn what this means. I am purple, 5 inches long, and I'm shaped like a bean. I'm your spleen. You will learn what this means. I produce antibodies and I keep your blood clean. I'm the spleen, the largest organ in the lymphatic system. You don't need me, but if removed from your body, you'll be more prone to infection. The spleen is located under the rib cage above the stomach, here in the upper left quadrant of the abdomen, the space I share. What's the anatomy of the spleen? Yeah, the spleen's parts. I will teach you this now while you look at the splenic work of art. Here you see the splenic hilum and the gastric surface. There's the pancreatic and renal surface. Now repeat this. The splenic artery supplies oxygenated blood to the spleen, and the splenic vein drains the blood from the spleen, if you know what I mean. Let's take a look inside the spleen to learn more of its parts. There are 2 main types of tissue in me, and that's where we'll start. The first main tissue is called the red pulp. Of this I will tell. It filters blood of antigens, microorganisms, and defective red blood cells. The second main tissue is called white pulp. We'll view this as well. It's part of the immune system, mainly made up of white blood cells. The trabeculae of the spleen is the framework within, which is attached to the capsule. It surrounds the spleen and it's thin. Vascular sinusoids are wide vessels that drain into both veins. We'll learn how this all works, but first let's sing again. I am your spleen. You will learn what this means. I am purple, 5 inches long, and I'm shaped like a bean. I'm your spleen. You will learn what this means. I produce antibodies and I keep your blood clean. All the functions of your spleen are really complex, but I'll explain the basic functions in the next few steps. Red blood cells last 120 days, delivering oxygen to your body. When they're damaged, entering the spleen, recycled is what they'll be. Healthy cells flow through, but those that are in their unhealthy stages are broken down by large white blood cells that are called macrophages. This all happens in the red pulp tissue that we talked about. These macrophages' main job is to filter all the damaged cells out. These old red blood cells are turned into conjugated bilirubin, which is excreted through bile out of your body. Then the white pulp consists entirely of lymphoid tissue. Here I will explain the basics of what it does for you. When you get sick or have some sort of nasty disease, the lymphoid tissue within the white pulp sets your body at ease. It creates white blood cells to fight off the sickness, and then it also makes antibodies that bind to specific antigens. Both white blood cells and antibodies fight sickness and disease, enabling them to be cleared from the circulation in your body. The spleen stores up to a cup of blood for your safety, ready to be released if there's a significant loss of blood. You see, many platelets are also stored within the blood in the spleen to help form blood clots to prevent further blood loss, if you know what I mean. Please take care of your body so you don't get sick, and if you do, the spleen will be there to help you fix it. I am your spleen. You will learn what this means. I am purple, 5 inches long, and I'm shaped like a bean. I'm your spleen. You will learn what this means. I produce antibodies and I keep your blood clean. Go to the new KLT Anatomy channel. Click the link in the description below. I'm a muscular sac, I'm called your bladder. I carry urine from your body straight down into the potty. I'm a muscular sac, I'm called your bladder. Your kidneys make your water waste and it's stored in just one place. Your bladder is the size of a pear when empty, and is made of all the parts that you're about to see. Here's a picture of the bladder's anatomy, located in the anterior pelvis happy. The peritoneum covers the upper posterior surface. It's the serous membrane, and I'm glad you're learning all this. The ureters bring urine waste from the kidneys. Smooth muscles move it down using peristalsis, you see. Urine enters the bladder through ureteral openings and fills the bladder up like a leaky ground spring. The detrusor muscle controls the bladder's fluid flow, lined with inner mucosa encased in outer membrane though. The urethral sphincter allows all the waste urine into the urethra where urination does begin. The external urethral sphincter is what you control to allow the amount of urine you put in the toilet bowl. I'm a muscular sac, I'm called your bladder. I carry urine from your body straight down into the potty. I'm a muscular sac, I'm called your bladder. Your kidneys make your water waste and it's stored in just one place. Your kidneys filter all the blood in your body. If you want to learn more, watch my video on kidneys. When water waste separates from the kidneys, it will exit your ureter, start the process of peristalsis. This process moves the urine to where it should be stored, to the bladders where it's headed. I hope you're not bored. When the urine reaches your ureteral opening, the detrusor muscle relaxes while the bladder's filling. When your bladder is full, it stretches its walls, and stretch receptors tell your brain the urine must fall. The brain tells the detrusor muscle to contract while the internal urethral sphincter opens. That's a fact. carry urine from your body straight down into the potty. I'm a muscular sac, I'm called your bladder. Your kidneys make your water waste into stored in just one place. Thanks for watching KLT. Please subscribe to this channel, like our videos, and check out the KLT merch store.